Hi guys, Dr. Gillard once again. Welcome to Spinal Anatomy. This is our first lecture, and here we go. It is the spring of 2020, week 1. Here we go, Spinal Anatomy. Star of the show is the coccyx. So this is the spine. This is what we're going to be studying this quarter. Cervical spine, thoracic spine, lumbar spine, sacrum, and then this little thing down here which we're going to talk about today. That's the coccyx. These are the books that I created this program from, Kramer and Bogduke. These are both National Board of Chiropractic Examiner listed books. So where do the board questions come from? These books. No board question will come if it's not out of these books. Talking about national boards, last year I was actually invited to write questions with some very famous people. That's my Spinal Anatomy writing partner, Kramer, the author of Kramer, which is a board book. So that was a great honor to meet him. And yep, I am invited back this year. I'll be on General Anatomy. This in July, where the session is joining, so it'll be my second season. I'm very grateful to be a member of that group. All right, we did this yesterday in embryology, but let's look at this again for spinal anatomy. I won't go over it too much, but you gotta for gross anatomy, spinal anatomy, embryology, you can't escape knowing these planes and which way's up, right? So let's start with posterior dorsal is to the back side, anterior ventral is to the front side, superior cranial cephalad means up. Example, the shoulder is cephalad to the elbow. Okay? The opposite is inferior and caudal. So the ankle is caudal to the knee. Okay? Lateral and medial, did I not leave that on here? Lateral would be more to the outside. Medial would be more toward the inside of the mid. Oh, here it is. Lateral is more toward the outside. Medial is more to the inside. So let's see. The shoulder is lateral in relation to the cervical spine or neck. The cervical spine is medial in relation to the shoulder. Okay, basic stuff. Proximal and distal we've done before, but distal means more distant. So the wrist is distal in reference to the elbow. It's distal in reference to the shoulder. And vice versa, the shoulder is proximal in relation to the elbow. It's proximal in relation to the wrist. Pretty straightforward. Here's these planes we talked about in embryology, but again, the HAT or chat is the mnemonic. Cross-sectional, horizontal, axial, transverse is a slice like the screen plane here. A mid-sagittal cut is a cut right down the middle. So here's a mid-sagittal plane. Sometimes it's called a median plane. Median plane. I should have put a star here because I will definitely ask you a question about this. A coronal plane is a slice kind of through the shoulders here, also called the frontal plane. And yep, I think we got through those. Just some general stuff before we start the coccyx. The spine, there's 7 cervical vertebrae. Of course, these are the cervical region here in the cervical vertebrae. The dorsal spine, sometimes it's called, or the thoracic spine, there's 12 vertebrae and 12 ribs. Lumbar spine, 5 vertebrae. How many ribs? There's no ribs. The sacrum, when you're a little kid, you actually have 5 kind of sacral vertebrae, but they fuse together by, if memory serves, about the age of 15 to 20 or so. I'll correct myself when we come to that section. But when you're a little kid, there's actually segments. Some people, S1 and S2 never fuse together, and a rudimentary disc can even be there. Coccyx usually has 4 coccygeal segments. That's the star of the show today. We should also talk about some curves. There's a lateral curve. If you look from the right side of the body, we have lateral curves, or just look from any side of the body, the left or right side. We have a cervical, thoracic, and lumbar curve. Those are lordotic, kyphotic, and lordotic respectively. There's also a kyphotic sacral curve and a kyphotic coccygeal curve as well. All right. From an A to P view, of course, there should be no curves. If there's a curve from the A to P view, you got yourself a scoliosis. Here's an A to P, or this is actually a posterior to anterior view, and the spine is pretty straight there. Here's a lateral view of the spine. You can see there's our nice lordotic curve, very important for normal structural biomechanics. Kyphotic curve is here. Lordotic curve is in the lumbar spine, and there's our sacral and coccygeal kyphotic curve. Okay, and here is just looking at a full spine radiograph. We can see all the bones called vertebrae. We can see a fairly straight looking spine. Nobody's perfectly straight like in the books. Pretty much a normal curvature there. From the side view, though, we can see the jaw there. There's this head. We have a nice lumbar curve. There's actually some malformation here, isn't there? Just noticed that. Looks like that's a transitional segment. I would see it. I have to blow that up. And let's say it looks like 12. 1, 2, 3, 4. Yeah, there's something funky going on there. I need to blow it up to see. But the point of this is there's a nice lordotic lumbar curve, and then we have a kyphotic sacral curve. Okay. All right, star of the show today is the coccyx. So here we go. The coccyx is the little tailbone, the colita as it's called in Spanish. And there it is. Here's a 4-segment coccyx. It attaches to the sacrum, and it's triangular shaped like the sacrum. Makes up the most caudal or inferior segment of the spine. It is part of the spine. It's made of 4 coccygeal segments, which are considered rudimentary vertebrae. There's labels for each one of these. I could have put CO1, CO2, CO3, CO4, or CX1, CX2, CX3, CX4. So you can label it like that. You can't label it. C1 and C2. How come? We haven't talked about it yet, but that's the cervical spine's nomenclature. So we can't use that. We have to use CX. I think it's probably better to use CO because, look at this, CO2. So you might confuse it with CO2. So maybe better to use CX. I use CX. Well, I use them both the same. All right, here's a view of the coccyx. So we are, notice how there's the tip of the sacrum. It hangs off the sacrum there. It has an apex and a base, just like the patella actually, and just like the sacrum. They all have an apex of the base. Weird thing about all 3 of those bones, the patella, sacrum, and coccyx, the base is up here. Isn't that kind of weird? You would think a base would be down on the ground, and the apex, like a apex of a triangle, is right here. You would think the base would sit on the ground and the apex would be in the top, but that's not the case. So that's a little bit strange. I remember asking this question in the test. The base of the coccyx connects to the apex of the sacrum. Okay, what is the sacrum? What does it do? Well, according to Rothman-Simeone in their research, it's, for all practical purposes, it's a tail. But it's a vestigial tail. What's vestigial mean? That means through the process of evolution, it's been eliminated. And all that's left is these 3 or sometimes 4 segments. It can be anomalous, by the way. It can have 5 segments or 3 segments. Here's a 3-segment coccyx. But vestigial means it's kind of evolved itself out of existence. What's the proof that it's a tail? Well, I always present this case from the British Journal of Neurosurgery, quite a prestigious journal. So a 2010 article where a baby was born with a tail. And surgically, it was found to be connected to the coccyx. So there's a tail that grew back from the days of old. Anybody see another problem with this? Let's see if you can catch it while I take some water. This is my second, let's see, this is my what? My third lecture of the day? Fourth lecture of the day. Okay, some people are going, what in the heck is that thing? That's not a good thing. That's a spina bifida manifesta. That's a spinal cord that's actually herniated out of the spine. And the trouble with that is it tangles nerve roots up. And anybody see any other problem? Okay, good. What's going on here? What's going on with the glute? Why is it all wrinkled? Because there's not much glute muscle there. The nerve that supplies the glute, inferior gluteal nerve, is tangled up and destroyed in here. So the poor little guy's going to have a lot of trouble as he or she grows older. How does it develop? A little embryology of the coccyx. There's only one ossification center. So most bones have 2 or so, but this one just has 1. And surprisingly, here's the ossification. The ossification it doesn't occur, quite variable, between 1 and 20 years old. So some 15-year-olds may have a coccyx that's still made out of cartilage. What does it do? It doesn't do anything, really. It has no supportive function to the spine. You can definitely live without it. But it is an attachment point for some muscles. Gluteus maximus, the big kind of butt cake muscle. Some fibers attach in there. A muscle called levator ani, which you'll learn next quarter in Gross 2 anatomy. Coccygeus muscle attaches on there. And then it's an attachment site for some ligaments. We'll look at it in a minute. We'll look at the ventral and the dorsal coccygeal or sacrococcygeal ligaments. Did I leave lateral out? I did. The lateral sacrococcygeal also attaches to the coccyx. We might add that to the list. Intercornual ligaments attach there. Filum terminale externa attaches there. So those are all important. Here's an overhead view or a axial view or horizontal view, cross-sectional view, whatever you want to say. Here's the sacrum. I know we haven't studied that yet, but we will get to that. Front of the coccyx would be right down here, and we can see some muscles attached to it. There's the coccygeus muscle right here, and it goes down a little bit underneath levator ani to attach. There's levator ani. It's a big 3-pronged muscle here, but part of the fiber's attached there. And we said gluteus maximus, cadaver view of gluteus maximus, and this cadaver's laying face down. There's the hamstrings right here. Okay, and there's gluteus maximus muscle connects in there as well. A to P and P to A view, nice, just showing where those muscles connect. So levator ani and one called the sphincter ani, they connect on the front of it. This is an A to P view. From a PA view, from a back view, just a little tip is connected by those. So these muscles connect mainly to the front. And from a back view, the star of the show is definitely gluteus maximus. On both sides anchor in there pretty good. Okay, what connects the, because we said those are segments, right? CX1 through 4. What connects them together while you're waiting for them to fuse? There is a little fibrocartilaginous disc, a little pad that sits in between them. Guess we could draw that. Here's a coccygeal segment, let's say. Here's another coccygeal segment. This is a PA view. So there is, I really like this drawing program. There is a cartilaginous pad, which is similar to the intervertebral disc that is in there, although it does degenerate away most of the time with the passage of time. Here's specifically about the third decade of life, so a lot of you guys are probably, what's the third decade? That's the 20s, so probably some of you are in the 20s. So your coccygeal fibrocartilaginous discs are degenerating and turning kind of to stone. They don't degenerate. They turn into bone. They ossify. And therefore, in people in the 30s and 40s or so, Most of the time the segments don't move, and the coccyx is one big osseous bone. Occasionally it can take a lot longer for those little discs to fuse away. Sometimes they never fuse away and they remain there throughout life, but most of the time they do fuse away. Okay, when we talk about the coccyx, the only one that's really worth mentioning individually is the first coccygeal segment. And it's larger than the other ones, and it even has some transverse processes. It even has some makeshift superior articular processes that we can look at. I didn't write that in there. It has an articular facet on its base we'll look at, where it articulates with the sacrum, two transverse processes, and it has these little prongs sticking up, which are rudimentary superior articular processes. And that'll make more sense to you. It's like we got to start the spine somewhere. It'll make more sense to you when we get into the lumbar region, what these articular processes are. But yeah, so those are called the sacral cornua. Cornu is singular. Okay, so let's take a P to A view, look at the back of a coccyx. So here's the first coccygeal segment right here. The root disc looks like it's pretty much fused, and we can see some weird things sticking out of it. There's a base up here. We can see it better in a different view. But here's the coccygeal cornu right here. Cornua is plural. The little horns that stick up. Guess what? There's sacral cornua that come down like this. And and these connect. There's a ligament, intercornual ligament, that connects these together. That's the deal there. So sacral cornua up here. Coccygeal cornua is right there. Transverse processes, little airplane wings, stick out from the side. They're not as long as most of the vertebrae are, but nevertheless, they are there. Articular facet, as we said, on the superior surface of the coccygeal base, there is an oval-shaped articular facet, and that's just like the facet of the superior and inferior articular processes that we'll talk about. It's just like the facet that is on your patella and on your tibial plateau. They're all over the body. So they're pads of fibrocartilage, and they're covered with synovial membrane most of the time, and they're part of a diarthroidal joint. So the facet, on top of it, it has a small disc, which connects to the apex of the sacrum. So just like the intercornual segment, or just like the intercoccygeal segments, there's a disc between the sacrum and the coccyx as well. Here's an AP view. Now we can see this is, how many segments does this have? 1, 2, 3, 4. This is a 5-segment coccyx. But here's actually a disc that's failing to ossify, so that might even show up on radiograph. But it would be pretty stiff, like the symphysis pubis. But from this view, we see the transverse processes again. Here's the cornua, the coccygeal cornua. And here, there's a fibrous little pad that the author tried to draw, and that's the facet of the coccygeal base. So that's a good one to know. That's actually one of the lab, the same picture I think is in your lab worksheet. Okay, and what else do I need to say about that? That's about it. More about the first coccygeal segment. Here's a real live one, or not live one, obviously. But you can see the sacral coccygeal disc right here. You can see the sacral cornua quite nicely. Okay, and we talked about those already. They project upwards. Cornua may be considered a vestigial superior articular process, and even pedicle. Some of the embryological remnants, if you dig through this, they same elements that give rise to the pedicles and superior articular processes form these things. And another important thing about this is that we'll learn when we talk about the sacrum tomorrow. The sacrum has foramen, anterior and posterior sacral foramen, where the sacral nerve roots pass out of. But there's 5 sacral segments, and there's only 4 sacral foramen. So what's the deal with that? Well, the deal with that is we kind of have to have a makeshift fifth sacral foramen. And so if I draw this in, this is actually where the nerve root, the S5 nerve root, would come right out of this hole, or go right through that hole. So that's weird. So the question is, who are you? Who is this ligament right here? It's really easy to remember. It's lateral. So it's the lateral. This is the sacrum here. That's a bad color. Sacrum. So this is the lateral sacral coccygeal ligament. That forms the S5 sacral foramen. Great board question. Not that I'm giving you board questions, right? I'm just saying that would be a good, if I was writing a question, that would be a question that I would like to write. Okay. What else do we need to say about that? The intercornual ligaments are also here. Let's see. I think we have an orange color. We can make those. So here they are right here. So these look like they've ossified. They can ossify and turn to bone in some people. Some people no. But they're there, intercornual ligaments. And all of these, the lateral sacrococcygeal ligaments and the intercornual ligaments and this sacrococcygeal disc, that holds the coccyx to the sacrum. That'd be a great question, wouldn't it? What holds these? Which one of the following holds? Or I always like these kind. All of the following. Here's my go-to question right here. All of the following hold the coccyx to the sacrum except for blank. My favorite type of question right there. Okay, we talked about the lateral transverse processes. Sometimes the lateral, these little rudimentary processes here, let's see, I guess I'll make them blue. Sometimes they can grow up and actually form a real bony hole. And some people, it doesn't happen that often, but they can create the fifth sacral foramen in that manner. Okay, looks like we're good. There's another cartoon, just like the one I kind of drew here. Over here, there's nothing. Sacral cornua are here, or sacral cornua are here. Coccygeal cornua are here. But here is a lateral sacral coccygeal ligament. All right, here's this. I think we looked at this before. There's that facet of the coccygeal base. And let's see. What else do we need to say? I think we covered all that pretty well. We already talked about the disc, actually. So there's a nice thick disc right here between the sacrum and CX1. That's a fibrocartilaginous sacrococcygeal disc, the sacrococcygeal disc. It forms a symphysis pubis type relation, so it forms a symphysis. You'll learn those in anatomy, the types of joints. And yeah, and this is not the facet. Remember, there's a facet that attaches to the base of the first coccygeal segment. The facets are like articular fibrocartilage. They're very strong. On top of that sits this disc. Okay, what about the sacrococcygeal joint? It's usually a symphysis type joint like the symphysis pubis, but some people, it can be a real diarthrodial joint and have movement, have fluid in it. That's not the norm though. And on the other end of the spectrum, some people it's completely fused to bone. You have to be really careful. There's some chiropractors like to adjust the coccyx. They have to be really careful in older people because it can often be fused into one segment and you can snap it. So I'm not a big fan of adjusting the coccyx unless there's a good reason. Coccyx, on your lateral x-rays, you can see a malpositioned coccyx sometimes sticking anteriorly. Like if this is the sacrum here, you'll see in a minute why I don't draw on the board. Well, this is the coccyx right here. But in some people with coccygeal pain, you might see coccyx like this on the lateral view. And some believe that you can go in through the rectum and grab this thing and snap it back into place. I'm not a big fan of messing, especially in the litigious society today. But nevertheless, it is taught and actually practiced, I think, in some chiropractic schools, not ours, though. But the problem with this theory is that some people have a naturally anterior coccyx. It grew like that in vivo. So there's really nothing wrong with it. And if it's one of these joints that is completely ossified here, you can literally break it off and cause more trouble. But I'll let the teachers, the professors can talk about that as you get through the program. Okay, let's look at this Gina, 43-year-old female, complains of coccygeal pain after an axial load slip and fall. What does that mean, axial load? That's a slip and fall right on the old behind. So that's never a good thing, right? Puts an axial load force into the spine. She had severe pain after that. Got a CT scan. What do you think? Would you adjust this patient? It's a side view of the coccyx and sacrum. Of course you wouldn't, right? You guys are first quarter students and you know not to mess around with that thing, right? Because coccyx should be right here. And it's not. It's snapped and displaced forward. So yeah, where do you do with this patient? Send him to the emergency room. That's what you do. And the orthopedist, they'll call the orthopedist in. Orthopedist will either remove it or he'll remove it. He won't try to sew it back on or cast it back on or plate it in there. All right, are we done? Nope, not quite yet. We didn't do the ligaments. So the coccygeal ligaments are always important. We looked at them, but let's officially cover them. So there's an anterior, and there's a posterior, and there's a lateral sacrococcygeal ligament set. So the anterior or ventral ones, these are an extension of the anterior longitudinal ligament. So that's really all they are, is the anterior longitudinal ligament that extends into the coccyx. They're typically double banded, though, so that's a little unusual. The anterior longitudinal ligament doesn't have two bands, so that's a little weird. And they, of course, connect the pelvis to the anterior surface of the sacrum, usually go all the way down to CO1 or CO2. Then we have the lateral sacrococcygeal ligaments. We've talked about those already. They correspond to the... Or no, we didn't talk about this. That corresponds... Oh, yeah, we did, but we didn't really. So let's finish talking about them. So they have kind of a cousin in the lumbar spine, and those are the intertransverse ligaments. So they're kind of akin to that, which are lateral. But they make, the key with those is they make the S5 sacral foramen. So that is a key with those guys. Here's another picture of them. You can see them right here in gray. And you can see the anterior ramus of the S5 sacral root coming right through here. And yep, make sure forward. Remember we said S4 are bony holes, but there's no S5, so you got a kind of makeshift one here by using this lateral sacrococcygeal ligament. Now there's a superficial and a deep posterior sacrococcygeal ligament. So this is a continuation of the posterior longitudinal ligament. The deep one we're talking about now, it arises from the posterior bodies of the lower sacral segments, and that'll mean more to you tomorrow when we start the sacrum. And yep, comes from within the anterior portion of the canal, and it connects usually to the dorsal part of CX1 and CX2. Let's look at a picture. It's a cartoon I drew. So there's a back of the sacrum, lower sacrum. There's the dorsum, backside of the coccyx. There's our coccygeal cornua, sacral cornua. But here this one is, and it's plastered to the bone, right? Stuck to the bone. And that's the deep dorsal sacrococcygeal ligament. Then there's a superficial. And did I say this is akin to the posterior longitudinal ligament? Then there's a superficial one that's akin to another important ligament called ligamentum flavum. We're going to talk a lot about ligamentum flavum, the yellow ligament. This one forms, it arises from the margin of the sacral hiatus, forms the roof of the sacral canal. Sometimes it completely covers the sacral hiatus. It forms a roof over the lower sacral canal and sacral hiatus. And that's about all you have to know. Here's a picture of this, and it's kind of a remnant of ligamentum flavum. There's our deep dorsal sacrococcygeal ligament, would be into the plane of the page and the back side here. All right, so that is it for this lecture. We will start the sacrum. We have a 2-hour lecture tomorrow morning at 7:40, so I will see you guys then.